let's go back to Clubfoot. Okay.
Mm-hmm.
What are the roles of healthcare providers? What role do they play in addressing the challenges faced by the people accessing healthcare facilities and treatments?
Okay, so healthcare providers, they play a big role. Of course, is in the health facilities that babies are treated. So that is the first role. They provide the treatments.
Okay.
You know, they provide training for staff, healthcare professionals. So let me use Clubfoot as let me use my partners as an example.
Okay.
So Miracle Fit currently has 2 partners in Nigeria: the Straight Child Foundation, and their headquarters is in Umuahia, in FMC Umuahia. And then there's an organization called Health and Development Support Program, HANDS for short. Their headquarters is in Jos. They support, what they do is that they oversee. So what all the things I told you that I do through them, right? They support this Clubfoot program in over 25, I think, as at 2 weeks ago, they launched the 26th clinic. So they go to clinics, empower them, provide equipment for them, provide the clinic materials for casting, and they provide training and a lot of technical assistance to them. So now they are currently in 26 hospitals in Nigeria. It is not enough, but it is a big step to the right direction.
That's true.
So healthcare providers, so other than the treatments, they provide information. Like I told you, if a healthcare provider, a nurse or a radiologist or a phlebotomist, a lab scientist is able to identify Clubfoot, that person will be able to quickly refer a baby that is born with Clubfoot to the right place. It might even be in their neighborhood. It might even be that Mama Sikira had a baby in the house and a healthcare provider is there just as an observer, and immediately the baby shows up with Clubfoot. Be like, okay, we actually treat this condition in my hospital. So they serve as a channel of information, I'll say that, to the public as well. They provide training, like I said, and like for instance, I've mentioned some of the trainings, early detection and referral training. There's an app, a data management app we use in gathering information.
Okay.
We call it CAST, capital CAST, CAST. Is an app that captures the baby's details, the baby's names, the baby's score. Before they start treatment, they will score the fee. There's a scoring system they call Pyramid score. So it's just like an M&E. If you're in public health intervention, if you're conversant with the terms, monitoring and evaluation are just like tools and templates, sometimes Excel sheets that used to gather information, data collection. So we use an app to do this real time. So if there's a clinic going on today that is Friday, like I know that some clinics, like the Aba clinic, today is their clinic. As they are seeing patients in Aba, as they are entering that patient data into the CAST system, I can see it here while I'm in Abuja. Or if I travel, or my colleagues in the US or wherever, I can see it. So this is also done by healthcare workers. Someone is assigned that role. So they play diverse roles. They also offer psychosocial support. You know, we all need some form of help, some form of support. Sometimes you need someone to talk to, and a healthcare worker sees it both. Imagine a woman that knows the rigors of keeping a family, and she's also a healthcare worker. She's able to relate even more. So she has the information she needs to share with you as a professional, and she also understands you from the human aspect. So they also act as psychosocial support to families born with Clubfoot, because it's not easy to deal with this condition and be in treatment for 2 to 3 years and comply to all that the doctor says you should comply to. So that's the role of healthcare providers.
See, I can imagine. See, I never knew anything about Clubfoot, but I suffer some of that Okay, but it's not. I didn't have it from birth. I have it because I have a brain injury. That's So I had a stroke. So
wow.
Yeah. So I have that's one of the things I'm struggling with. See if you can see my hand,
form of paralysis.
Yes. If you can see my hand, this side of this side of my body is not moving. Okay. Yeah. So that's so I understand what you're talking about.
Let me take a guess. You're probably working with physiotherapists, right?
Yeah.
Exactly. And it helps.
Yeah, it does help. And I understand when you say it takes a lot of effort from the mothers to make sure the child wears the shoes or the cast or the See, I know how difficult it is to maintain that thing. It's so difficult. Okay, so I understand that. I understand that.
Yeah.
So see, I don't know. For me, I would prefer not to ask this question, but let's just go with it. Let's just go with it.
Okay.
Okay. You know why I don't want to ask a question? Because I don't expect any. But let's go. See, what is the Nigerian government doing so far to support? Yes, you now know why I don't want to see. So let me not assume that they're not doing anything. Okay, so let me ask you.
Yeah.
What
is it
the
to
government?
Support Clubfoot treatment?
Yes.
Okay.
Yes.
Okay. I'm happy to. It's not a bad question. It's not. I like to discuss that. That is why I'm here.
Okay.
That is why I'm looking. I'm also happy for other opportunities to keep talking about it. Like I told you, my brother, many people don't know about Clubfoot.
Yes, that's true.
I don't know why, whether it's because people are ashamed, whether it's because of the associated stigma, so they are hiding it. But believe it or not, Clubfoot has not been integrated into the Nigerian health system.
Okay.
So you know the way you have Ministry of Health and you have different directorates and agencies, we don't have that for Clubfoot. So it's something we are working towards. In a few stakeholders meetings that I've been to, the Nigerian government is interested, but they've not taken the lead. I must be honest with you. So I will say that the good thing is that they're interested. So if an organization like Miracle Fit is willing to provide the technical guidance and assistance and say, this is the roadmap, I'm sure stakeholders, I'm sure Ministry of Health, and even those at the primary healthcare level, they'll be able to work together, all hands on deck. But for now, the Nigerian government has not done much to support the Clubfoot program. The only thing which is still big is that in most of the clinics, our partners work in Hands and Stretch Out Foundation. They are government clinics, so it's something.
Okay. Something. That's good.
Because if you want to try it, if you want to try it, if you want to pilot it, we have piloted it in 1 or 2 private clinics. It has not been very successful because you know that it's profit that is driving most of these private clinics. But in government hospitals, they've given us a warm welcome to provide that platform where the treatment will be done. But all other things, we are still working with them to make it fully established, to train the health workers.
They're helping a little bit.
Yes.
Okay.
Yes.
So you have a lot of work to convince them, and okay.
Exactly.